I think the main aha moment for me was the focus on the quality agenda and looking to health quality councils, the Canadian Foundation for Healthcare Improvement, and the larger quality agenda as a resource for ensuring that our approaches to population screening ensure quality. Because the big challenge with screening is to make sure that we don't just think about it as a test, that we recognize that it's a system of care, that the test itself is of no value unless there's appropriate follow-through for the individual. And so thinking about the quality agenda as a way to really drive a system focus in population screening. Right, so what needs to be done? I think there's lots of things that can be done. So starting at the provincial level, and where I'm most focused is in the maternal child screening world. And we have a tremendous opportunity within Ontario because we have a maternal child screening committee within the Provincial Council for Maternal and Child Health, as well as the Better Outcomes Registry and Network. So a pretty nice system for thinking about population screening and the entire life course, the journey of screening that women and their families take in the maternal child context, prenatal screening, newborn screening, early childhood screening. So there's tremendous opportunities, I think, within Ontario to really approach screening not as a single disease, not as a single profession, but as a system of care that is very patient-centered. And I also think because Health Quality Ontario is really pushing the envelope and pushing the agenda forward on quality, that there's opportunities to link our work, maternal child screening in Ontario, to the Health Quality Ontario mandate and the quality mandate there, and to really, as I said earlier, leverage the quality agenda in the population screening world. So that's within Ontario, and sort of thinking about the advantages of unifying our thinking across disease silos, so across a sector, and being more patient-centered. The other place where I think there's opportunity, and that was very exciting, that came out of today's discussion, was recognizing where some of the opportunities lie. So with the Council of the Federation having said recently that they're interested in thinking about newborn screening and the ways in which this differs across jurisdictions in the country, that there's some interest, I think, in leveraging that opportunity to bring some of the evidence and the analysis that we can bring to bear in thinking about newborn screening across jurisdictions and from a more patient-centered and system and quality perspective. So there's work to be done at the national level in thinking about population screening and standards for quality in population screening, and actually a political opportunity that might exist to take one example and move it forward in some ways. So I think there's lots of work to be done.